Fire prevention practices in healthcare settings represents a critical pillar of safety management within the medical community. This lesson focuses on the specialized protocols required to mitigate fire risks in complex environments where patients may be immobile or vulnerable. By establishing a rigorous fire prevention framework, healthcare facilities can ensure that the primary mission of patient care is never compromised by the devastating effects of an accidental blaze. We will explore how proactive measures and a culture of safety serve as the first line of defense against fire-related emergencies in clinical settings.
Importance of fire prevention is the foundation of this lecture. Reducing fire incidents is the primary goal, as fire prevention helps reduce the chances of fires occurring in hospitals through proactive risk assessment. Protecting lives and property focuses on how preventative measures protect patients, staff, and hospital facilities from physical harm and structural damage. Maintaining a safe environment ensures that a strong prevention culture provides a secure healthcare environment for everyone. These three pillars work together to create a resilient safety infrastructure that prioritizes human life and operational continuity in every medical department.
Good housekeeping practices are essential for daily risk management. Clean work areas are vital because keeping hospital areas clean reduces fire hazards by removing potential fuel sources like cluttered paper or textiles. Proper waste disposal ensures that waste materials are disposed of regularly and safely to prevent the accumulation of combustible debris. Clear pathways are a non-negotiable requirement, meaning corridors and exits should remain free of obstacles for safe evacuation during an emergency. Maintaining these standards ensures that the physical layout of the hospital supports rapid response and minimizes the likelihood of fire ignition. Electrical safety is a major focus due to the high density of medical technology. Safe use of electrical equipment dictates that electrical devices must be used according to safety guidelines to prevent malfunctions. Avoid overloading circuits is a critical warning, as overloaded power outlets can lead to overheating and fires in high-demand areas like intensive care units. Regular equipment inspection requires that electrical systems be checked regularly for faults to identify fray wires or failing components before they ignite. Consistent monitoring of these electrical assets is necessary to maintain the integrity of the hospital's power grid. Safe storage of flammable materials requires strict adherence to specialized protocols. Proper storage areas must be established, meaning flammable materials should be stored in designated safe areas like fire-rated cabinets. Labeling and handling is a secondary requirement, where materials must be clearly labeled and handled with care to avoid accidental spills or chemical reactions. Controlled access ensures that only authorized staff should handle or store flammable substances, reducing the risk of human error. These containment strategies are designed to isolate hazardous chemicals and gases from potential heat sources throughout the healthcare facility. Staff awareness and responsibility involves the human element of fire safety. Proper storage areas must be understood by all employees, ensuring flammable materials are stored in designated safe areas at all times. Labeling and handling training ensures that materials are clearly labeled and handled with care by every department member. Controlled access protocols mean only authorized staff should handle or store flammable substances, maintaining a strict chain of custody. By empowering staff with this knowledge, the hospital ensures that every individual takes personal ownership of the fire prevention practices necessary to protect their colleagues and patients.